So I'll start over. My name is Joe Vigil. I am a treatment court analyst with OJD in the Office of the State Court Administrator. I have supported the specialty court case management system that we have been using up until this point, and I will now be transitioning to support Reconnect product, which is going to be called TCMS in Oregon. And so I wanted to make sure and welcome you, and we're excited for this new adventure with Reconnect, and I think that there's a lot of really great features that you all are going to appreciate as you do your work going forward. So at this point, I'm going to hand it over to Christy to introduce herself.
Good morning. I'm Christy Combs, and I'm an analyst with the Enterprise Technology Services Division of OJD. And like Joe, I'm excited to be here helping you get going in Reconnect. And now I'll pass it over to Sophie.
Well, I'm Sophie Vayu. I'm the Director of Customer Success at Reconnect, and we'll be helping to lead the training and the implementation moving forward.
And Sophie, can I just a couple more things I wanted to say. I know that people probably don't want to be on camera, but I would encourage you, if you feel so inclined, to come on camera so that we can engage with you as if we were in person. I have found last week we did a lot of in-person trainings, and the engagement was really great. It gave us a lot of really good feedback, and we were able to answer a lot of questions. So if you're not on camera but you have a question, please pop on camera and ask us. Raise your hands, let us know that you have some questions. The other thing I wanted to say is if you don't have a username or didn't get an email to get logged into the system yet, if you could please drop your name, your email address, and your role into the chat, we will work on making sure that you get added to the system so that you can follow along. The other side of that is if you only are working on one screen and you follow along, it might be hard to follow some of the slides that Sophie's showing. So I know that's a personal preference, but just kind of wanted to highlight that. And I know people learn differently, so I guess do what's best for you. But I did want to highlight that Sophie will be showing a lot of things. And so if you want to just watch, you can also do that. So I think that is it for me.
All right. We'll go ahead and get started. So I'm actually going to move you guys over here. And we're going to start with a slide deck just to kind of go over a couple of things that we'll be covering. Give me just a second to sort of navigate my virtual world here. Okay. So these are the items that we'll be covering in today's training. So we're going to be going over how to complete these various functions within Reconnect or TCMS. This is going to be an interactive training for those of you who are logged in. Everyone should have access to essentially like a dummy client in the system. So as we're going through each of these features, if you're able to, again, pending that you've kind of logged in and see that client that's been assigned to you, you'll actually be able to kind of practice and document records for that fake client that's been assigned to you so that you don't have to just, watch me doing everything. You'll be able to kind of follow along. For those of you who aren't logged in or are having any technical difficulties that the OJD team isn't able to resolve, know that I'll be going through all of these motions. This training is recorded. We'll have a different, additional training materials available to you after the session. So if you're not able to follow along, no worries, you'll still get a lot out of this training. But yeah, what we'll be covering how to document contacts with the participants. We do that primarily through a feature called appointments, but there's also ways to do it through notes. We'll be talking about how to log behavioral responses. So this includes incentives and sanctions, but more importantly for this group, service adjustments, which you currently know as interventions in SCMS. So we'll be talking through how to document those in the system and where you can locate that information for your clients as well. We'll go over how to log UA results. Reconnect is going to have an integration with Redwood. So for those of you who use Redwood, who are used to your results automatically populating in TCMS, that functionality will still be available in Reconnect. So we'll talk about what that looks like in Reconnect, but we will go through how to log test results manually as well for those of you who don't use Redwood or may need to document test results. We'll go over alerts, which this is kind of the Reconnect version of pending violations in SCMS. We'll talk about how to document sobriety, which is done through a feature called Success Streaks in Reconnect. We'll go over some of the how to locate and update some of the key information that this group would likely need to be modifying in Reconnect. So that's going to include like updating someone's education or employment information, their housing information, and their assessment scores. Go through how to upload and locate documents. I'm going to give an overview of our goals feature, which is how participants are going to you're going to document their phase goals and treatment plans in the system. It's a really broad tool in terms of its capabilities and what it could be used for. So we'll just kind of go over the options for that. We'll go over how to run the staffing sheet for court, and then also going to give you an overview of our participant mobile app, the capabilities of that, and we'll go through how to use our communication suite for when you have participants logged into our mobile app, but our messaging tool can also just be used for staff-to-staff communication. So even if your program isn't using our mobile app on day one, you may still find that messenger to be helpful for communicating with other staff. All right, so first thing we are going to cover is how to document contacts with the participants. I'm curious to know, of the folks that are here, how many of you were able to watch that introductory video that I made that kind of gives the lay of the land of the system? If you haven't seen that, I may take 5 minutes just to do that so that yeah, folks are not sort of lost as I'm starting to navigate through Reconnect. I guess like anyone who hasn't seen the video, I don't know how to do this virtually.
Maybe I could do this at the beginning next time, but maybe if you haven't watched it, can you just drop a note in the chat and we'll see how many people have not reviewed it? Yeah,
Okay,
there's a few already.
we've got a few. Okay. So before we dive in, I will just take a minute to kind of refresh on that overview. So this is the dashboard of Reconnect. We're currently in the OJD training environment account. If for whatever reason you do not see OJD training environment in the upper left, that's probably because your program already has access to Reconnect. To get into the training environment, you need to click your initials in the upper right and go to switch account and navigate over to the training environment. When you log into Reconnect for the first time, you'll be brought to our dashboard. This is kind of the default homepage of the system. You can always get back to the dashboard by clicking the speedometer icon in the upper left. On the dashboard is a series of tables related to different features within the TCMS system. So we'll go through those today as we talk about, the different tools, but that's kind of how you toggle between the different data sets on the dashboard. Also on the dashboard, where we'll spend a lot of time, is this quick action. It's this plus sign in the lower right. If you click that, it's going to open a menu of different features that you can launch here. And there's a couple of these quick actions throughout the system, so it's good to keep an eye on those and be familiar with what you can complete by using that. On the left-hand side, this is kind of our main navigation menu. I'm not going to go through each of these icons because we'll spend time in most of them during the training today. The area that you want to be sort of familiar with is the client list, which is the 3 people icon on the left. If you click on that, you should see one participant who's been assigned to you that has your name. So we just kind of created, again, like a dummy client for everyone in the system. If you weren't added to Reconnect earlier, you may not see the client assigned to you. So again, just kind of follow on my screen for the items that you're not able to follow along with. But essentially, once we're live, all of your participants will live on this list. You can click on any of their names and you're brought to what's called their client profile in Reconnect. The client profile is a warehouse of information specific to this one participant. So on the left, we have a menu of essentially like an activity feed of their specialty court treatment court activity. So this is going to include like active. Been trying to explain this all last week. It's an activity feed because it's kind of like, yeah, it's their activity throughout the treatment court. So that includes like any alerts that have been assigned to them, documents that have been uploaded for them, their behavioral responses, a record of all of their contacts with treatment and probation. So again, it's just kind of that like ongoing feed of what they're up to. And then in the middle of the screen, we have another menu, which is essentially all of their demographic information. So this is going to include, yeah, where they're living, where they're working, their medical information, their health insurance information, all of that data that OJD is trying to capture about the participant. And of course, you'll see their photo and basic demographic information to the left right here. In the client profile, we do have another quick action. So if you click on that plus sign, you'll note that there's various tasks that you can complete right from that quick action as well. So navigating back to the dashboard, the first thing that we're going to talk about today is how to log a contact with a participant. So in SCMS, this happens in a couple of different places. For those of you who are POs, it's happening probably through the fields visits notes. Treatment is logging it through treatment notes. This is all going to happen in one central tool in Reconnect. So that's definitely a difference between SCMS and TCMS. And the way that we log contacts with participants is through a feature called appointments. So I'm going to tell you exactly how this works today. I'm also going to give you a little information of some enhancements that we have coming to the tool soon, just so you can be aware of some added functionality that will be coming down the pipe for this feature. But we're going to go over exactly how this works today, kind of the benefits of this tool, and the different capabilities depending on how you do your virtual or your report days with participants, how many folks you meet with regularly, and kind of those different scenarios. So the way that logging contacts works in Reconnect is that you create or schedule an appointment with the participant, and then you result the outcome of that appointment. And for this group, we'll mainly focus on individual appointments. However, I do want to call out that if you have, you structure your reports in a way that participants just need to come, between the hours of 9 and 3 on Mondays, you can create one appointment for everyone who's supposed to report during that time and then result it for each of them individually. So we will go over that group scenario just in case there's folks on the call who schedule their reporting like that. There's two main ways that you can schedule an appointment. I'm going to focus on the way to do it from the dashboard, and then we'll go into some of the other ways you can do it as well. So for those of you who are able to follow along, please do. If you're able to kind of see my screen and your screen at the same time, at least. If not, I would prioritize watching my screen rather than following along. So from the dashboard, again, getting here, you click on the speedometer icon in the upper left, you click on the plus sign here, and you go to add appointment. You're going to be brought to this screen where you're going to first select the participant that the appointment is for. And you'll note that you can select multiple names here. So again, if you do have 10 people who report every other Monday between 9 and 3, you can create an appointment and add all of them to it. And we'll talk more about that. Actually, before I get into how to do this further, I do just want to call out as well, one of the benefits to this tool that will be a change for you is if your program is using our participant engagement app, creating this appointment is going to give them a reminder in the app that this office visit, case management appointment, whatever it may be, is coming up. So there is benefit to scheduling these in advance so that the participant can see that on their calendar in the app for the day, as well as get a push notification reminder from the app telling them about this appointment. So that is an argument for changing the way that you kind of track your visits, in that rather than just logging them retroactively, you're scheduling them in advance. So maybe this becomes like kind of a Friday morning thing where you're scheduling your appointments for the upcoming week so that the participants can get those reminders. Okay, so going back into how to create an appointment, we go to that, the plus sign, we go add appointment, we select the client, we give it a title, we select the date and time. Just for those of you who are following along, just leave the default or maybe like push the time out a little bit further, but don't go super far in the future. Appointments do have the ability to automatically repeat. So you see here under the repeat configuration, I can have it repeat weekly. I can have it repeat bi-weekly. You are welcome to use this feature, but there are a couple of limitations that I want to make sure you're aware of. So let's say I were to set this to repeat weekly, repeat every week on Monday. We're used to in systems like Outlook, when we create a repeat appointment, that we have the ability to edit or delete individual instances of that recurring appointment. So if I were to set this to repeat every Monday, but I need to cancel next Monday because it's a holiday, in Outlook, I can do that without impacting the rest of the series. Reconnect doesn't offer that yet. So if I were to set this to repeat weekly on Monday and I need to cancel next Monday, it's going to cancel all future instances of the appointment. That is on the radar to improve, and it's something that we will definitely improve next year. But in the meantime, it's important that you're aware of that limitation. I still encourage you to use the repeat configuration, but you just need to know that if you do cancel or edit an appointment that repeats, it's going to cancel or edit all future iterations of that repeat appointment. So you'd have to go in and either edit it again or recreate it if you canceled it. The other option is that you could not cancel it and just log the outcome as like rescheduled. That's another option. But if you are using our participant mobile app, and you don't cancel it, the participant is still going to get a reminder. So you need to like let them know to ignore that. So just some, potential complexities to be aware of there if you do end up using this. The visit type, this is kind of the category of the appointment. We will be adding additional categories to this soon, but in the meantime, this group is probably going to mostly focus on either office visit or field visit. And just because I've led this training for a week at this point, so I'll just kind of bring up some feedback from the rooms that I've been in since we're not in a room together. For POs, they don't sometimes want to schedule those field visits in advance, or they don't want the participant to know that the field visit is coming up. So in that case, you just wouldn't schedule the appointment in advance and you would log it retroactively. Visit format is just virtual or in person. The service dropdown, so this is an optional field. I think it's probably a little bit more relevant for treatment providers, but this basically just allows you to default your name, your agency's name, and the address of where you meet with participants onto the appointment. Your coordinator would have to add this as a dropdown in your account, so just know that you won't see any of your information on this list. But the idea is that you're just kind of adding yourself as the service provider to the appointment in a drop-down format. And then there is a URL field. So if you're meeting with the participant virtually, you can put that URL into the appointment and they will see that in the app and be able to click on it. Okay, so I have created an appointment for my test client for, yes, today in 10 minutes. So I'm going to click add on that. Okay, so that schedules the appointment in Reconnect. Next, we're going to talk about how to result the appointment or log the outcome and attendance and any notes associated with that appointment. This is where I want to call out one of the enhancements that is coming for this tool, because right now, in order to result, basically to log the contact with the participant, you have to create the appointment first. That's going to be beneficial no matter what if your program is using our participant engagement app, because again, creating the appointment in advance allows the participant to get a reminder for that appointment. However, if it's a field visit and you don't want to schedule it in advance, I want to acknowledge that that sort of two-step process of having to schedule the appointment in order to log the outcome may feel a little bit cumbersome. So one of the enhancements that we have coming for this tool soon is that when you are adding the appointment, you will be able to log the outcome right from this screen. So right at the bottom of this sort of form that you see here, there will be an attended drop down, a visit notes drop down, so you'll be able to do that all in one. Today, it has to be a two-step process no matter what. So just want to call out that functionality will be available soon. It will likely not be available on day one, but it is something that's coming down the pipe. So just want to sort of let you all know that we're already working on that. Okay, so we've created that appointment. Now we're going to transition to talking about how to result the appointment or log the attendance and the outcome. Our appointments tool is part of our event service. So we're going to navigate over to our event portal to log that outcome. And that is going to be the calendar icon with a star on the left. To log that appointment outcome, we're going to click where it says appointment log. A couple things to note about this log. Right now, this defaults to loading all appointments from the past month. I have access to every client in this account, and that's a lot of appointments from a week's worth of training. So you notice that page loaded a little bit slowly for me. These time frames in the upper right allow you to control how many, like how far back, how many appointments in the past do you want to see? So if I only want to see appointments from the past 2 weeks, I can toggle that since and up to be a smaller range, and it'll help that log load faster. I honestly think it should probably only load the past 2 weeks anyway. So that's feedback that I'll be providing. But in the meantime, it does load the past month, which just kind of depending on how big your program is and how many appointments you have access to, that could be a lot of appointments. So shrinking that window while it's loading will help it load faster. The other thing to note is that this log is definitely configured to show you appointments in the past. And so the up to date only goes 1 day in advance. If you don't see the appointment that you scheduled, just toggle that up to date in the upper right to be a little bit further in the future, and you should see that appointment pop up. You can filter this log by any of the columns that you see here. So I'm going to filter it to my test client. And there is that, actually, I've got a lot of, here's the appointment that I just scheduled today. So to result the visit or log the outcome, you're going to click on this log button in the appointment log. You're going to document the attendance in the outcome field. You're going to put your visit notes here, and then you're going to make sure this hours attended is accurate. The hours attended is going to default to the length of the appointment that you scheduled, but if you end up only meeting with the participant for half that time, you're going to want to modify that. This is a really important field because it's allowing us to capture the dosage of each type of service that participants are receiving. So as we look at like recidivism rates over time and outcomes, being able to see like how much probation services did the participant receive, how much case management, how much treatment, this hours attended is going to allow us to do that. So it's really important that this is accurate. What you need to know about this field is that it is calculating hours. So if you meet with the participant for 90 minutes, you do not want to put 90 in this field. That would represent 90 hours. So 90 minutes would be 1.5 per hours. If you meet with a participant for 15 minutes, that should be 0.25 because it's a quarter of an hour. So that's how you want to utilize this to capture that dosage. And then you just hit save, and that outcome now lives in the log. Another thing to note, so this came up last week as well, what happens if the participant is excused from the appointment? We'll probably add that as a drop down, but in the meantime, if you select other and type in an outcome, that will appear on the log as well. So other staff members have access to this. So it's helpful in the meantime if one of those outcome drop downs doesn't capture what you're trying to document, that if you type something in under other, the team members will see that. I'll take a break there. Any questions before we continue on with this feature? Okay. All right, so
I have a question. Sorry, I couldn't get myself unmuted
no
fast enough.
worries.
My name is Gina Chappell. I'm part of the recovery support team with DHS, and I am there to support clients or parents that are involved with the child welfare system. And I am wondering, I don't have all of these little things on the side of my page as you do. Are these things going to be added to my sidebar, or am I just looking at the training page?
I can jump in real quick. Gina, I'm fairly certain I saw your login, and I think your role was listed as other. So the other role is pretty limited. So I think it'll depend on your local program and talking with the coordinator and your team to see like what role you'll have with entering. If you're an other role, you don't have as many options. You have a little bit more just view only. So in this session, we're kind of going into what people can do when they have like the full case management or probation role. So I think that would be something that you would want to talk with your local team about what level of access you would need to do the work you're doing,
Okay,
if that makes
awesome.
sense.
Thank you. I just
Right.
wanted to make sure I
Yeah.
wasn't missing anything.
Yep.
No, that's good.
Thank
Clarified.
you.
Any other questions? Okay. So staying right here in the event portal, again, that calendar icon with the star, you'll note at the sort of right above the appointment log, you have the option to add an appointment here. You can use this. There's some differences between creating an appointment here and creating it on the dashboard. One of the key differences is that you don't have that service drop down. So instead, you're just typing in your agency name and agency address. This format is also less conducive to selecting multiple participants at once. But again, for this group, you're probably going to be doing a lot of individual, contacts with participants. So you may find that that limitation is not an issue. The other thing that I want to point out about this version of creating an appointment is that you can customize the reminders that the participant receives. So when you create an appointment on the dashboard, the participants do get a reminder, and it just defaults to sending the reminder an hour before the appointment. When you're creating the appointment here, you can control the delivery time of the reminder, and you can add additional reminders. So if you find that helpful, this can be kind of a beneficial place to schedule your appointments in that case. Also, let's stay here for now. I want to talk about what happens when you need to edit or delete an appointment. So there's a couple places that you're able to do that, still staying right here within the event service. I think that this is having trouble loading because of how much we've done in training. It may be a setting that I need to figure out as well. I'll come back to that in a minute, but the event log is essentially a calendar icon of all of your appointments, or not a calendar icon, just a calendar view of all of your appointments. But we'll go back to that in a second. So what I think is typically the easiest way, even when the event log is loading, is the Event Explorer. This is going to show you appointments based on the participants that you select. So go ahead, if for those of you who have created an appointment for your test client, navigate up to the Event Explorer and select your test client from the dropdown, and then hit search. This is going to show you that calendar view that the event log offers. So this is basically what the event log is this calendar view. And you can click on, just kidding, it's view only. You could click on the appointments here, but you can't. So you can view your appointments in a calendar view. And then on the left, you have a chronological list of all of the appointments related to that participant or participants that you've selected. So if you wanted to see all of your appointments on this, you would just, under the clients dropdown, you would just select all clients, and it's going to show you all the appointments pertaining to participants who you have access to in TCMS. So on the left is a chronological view of all appointments for the time frame that you've selected, which is right here. And then it shows you basically month to month. So you see I have appointments from December 1st to March 1st. And I can toggle between the months right here by going back or next. So one thing to note about this list on the left, because it shows you a month at a time and my time frame starts on December 1st, it's showing me appointments, from December 1st, and I've got to scroll down to get to appointments that are upcoming, or like current or upcoming. And you'll note that that trash can icon is not available on my earlier appointments, but it is in my upcoming appointments. So you can't delete appointments that are in the past. You have to scroll to the current day to be able to modify your appointments. You can't edit appointments that are in the past either. I don't really know why the edit icon even shows. So just know that about the Event Explorer, is that it's going to show you all appointments for the time frame that you've selected, broken up by month. But if you're coming in here to edit something, you need to know that you need to scroll to a current or future day to have that edit capability. So now I can come in here and there's my office visit appointment. And actually that's already in the past at this point. So now I can't delete it. But you see I have the ability to delete this testing appointment for tomorrow. So to edit or delete, you just click on these icons and click yes if you need to delete. Again, a reminder that if that appointment is set to automatically repeat every week, that you are deleting all future instances of it as well. I think that's everything I want to cover in the event portal, but before we move on to our next subject, I do want to show you where these live within a client profile as well. So for those of you who are following along, you're going to click on the client's icon on the left. You're going to locate your test client and click on their name to go to their profile. And on the left-hand side, you're going to see where it says events. You're going to click on that. And that's a drop down. So once you click on events, you're able to click below into the appointment log. So if you're just, wanting to get a view for a specific participant of their past appointments and whether they've been attending or not, this is going to be a log of appointments specific to the client that you're clicked into. You can also view their past and upcoming appointments on this event calendar. And this is a calendar of appointments specific to the client. So the idea is that, again, because treatment is going to be using this feature as well, case managers, probation officers, everyone will be able to see a participant's appointments on their calendar, which may help with, scheduling and seeing what the participant has going on outside of the service that you're providing to them. Joe, anything you want me to cover in more detail or go over again before we move on to staffing notes?
No, the only thing I kind of recapping, you talked on the appointments, you talked about the time, the dosage, and I think that that's a really important thing going forward statewide. I know that that's an area that that we're interested in kind of tracking, as well as the Criminal Justice Commission. If you are funded by them, they've expressed interest in being able to track that as well. So I think when Sophie showed that how to result appointments, having that time in there is really something that is really going to be critical going forward. I like that it defaults to what you've scheduled the appointment. So, worst case scenario, you're at least going to get the credit for that, the amount of time that you scheduled the appointment. But I do think it's an important thing to pay attention to, and I think it'll really help for stats across the state to measure, based on the dosage of, treatment or probation hours, and then outcomes, like where's the sweet spot to do the best for the clients. So that's one area I just like to reinforce again.
Okay, thanks.
Yep.
All right, so that feature is for logging your contacts with the participants. I think this is going to vary by program, whether you use that for your notes for court. So any appointments that you log for the participant, as well as any notes that you put into this visit notes section, those are going to appear on the staffing report in Reconnect. So that is a very, you have to use that feature to log your contacts so that we can capture that dosage. We have some programs that the POs or case managers are going to put kind of the participant's summary for the week or the period of time leading up to court into this feature. There is also a more general staffing note feature that you can use if you're wanting to provide a summary for court that maybe isn't appropriately captured in one like visit outcome, or if there are other things related to the participant that you want to share with the court, like conversations that you had with a family member or summary of a situation that happened over the past 2 weeks since the participant was last in court. You can use a general note for that if that ends up making more sense for your workflow. So we're going to do this from the dashboard. You can also do it from the client profile, but the dashboard, again, just kind of allows you to do lots of things from one screen. So I want to be kind of directing folks to that and making sure they're comfortable navigating that. So on the dashboard, again, I'm going to launch that quick action in the lower right, and I'm going to click Add Bulk Note. Don't be thrown off by the word bulk here. You see that I have the ability to select multiple clients, but I don't have to. I have to select at least one client. So if you find that you are using this feature to create, summarize your notes for court, the benefit of doing it from the dashboard is that rather than having to go to each participant's profile and launching the quick action from their profile, I can sit here right from this one screen and log all of my staffing notes one after the other, right, just by creating multiple bulk notes. If it's ever appropriate to create a note for multiple participants, you can do that. That may probably not be as common when you're trying to provide a summary for court, but that capability is here as well. But it's just kind of a convenient place to log your notes if you're going to be logging multiple. So for practicing this sort of general staffing note, we're going to select our test client. We're going to select the date and time of today. I think that it should just default to that, but it doesn't right now. Our staffing sheet works a little differently than what you're used to in SCMS. So previously in SCMS, you had to know the participant's next court date and select that when you're logging a note. Reconnect instead is going to pull any notes from the time frame that the staffing report is looking at, which is typically defaults to the past 2 weeks. So if you have court in 2 days or you have court a week from now, you want to make sure you have the date and time selected so that the staffing report knows to pull that note onto the report. And then the only other thing that you have to do to get the note onto the report is on the tag, you need to select staffing. Our staffing report, you'll see that you have lots of other tags that you can select here. Those are essentially just note categories. But the staffing tag is what pulls onto that staffing sheet for court. No other note categories pull onto the staffing sheet right now, at least. We may change that. Right now, you can also only select one tag. So you may be logging law enforcement contact, but if you want that note to go onto the staffing sheet, you need to tag it as staffing. So potentially some enhancements that could make that a little more intuitive, but for now, just know that if you want that going on the staffing report, you need to tag it staffing. So for those who are following along, let's go ahead and add a staffing note for our test client so that you can see how these pull onto the staffing sheet. And we're just going to hit submit. So just to talk about notes a little bit further, we're all going to now navigate to our client profile. I want to show you where that note lives. So any notes that you document through that add note quick action are going to go to the records section in the profile on the left. They're going to go into this table here. You can also document a note here. That's totally fine. If you find that easier, you're welcome to use that. And then those notes live in the table below. This is not a very traditional way to see like a feed of notes. So I want to kind of call that out and acknowledge that that's, this is, I think, we've all used enough systems to know that we're pretty comfortable or like used to notes appearing in sort of like a Facebook feed format. So we will be migrating our notes to display like that sooner than later. But this is how they visualize for now, and it was meant to accommodate load times as we migrate in probably like millions of notes from SCMS. This just ensures that this page will load quickly and efficiently, and then we'll look at kind of updating that user experience and making it a little more intuitive to scroll through. In the meantime, you just hover over notes and they'll appear in this pop-up here. You do see that you have the ability to edit your notes here. That goes for appointment notes as well. This is a new capability within TCMS compared to SCMS, where you previously had to reach out to your coordinator to have your notes be edited. When you edit a note, all it does is creates a new copy of the note with your edits, and the old version lives below. So you're not like removing the previous version, you're just updating it, and therefore the original note is still there. And that's how we're kind of able to give you that edit access, so that OJD is comfortable with that. While not, creating this inconvenience where you have to be reaching out to someone if you, make a note by mistake or list something accidentally. Another thing I just want to kind of call out, just so you know that Reconnect is already aware of this enhancement need, is that right now when you log a note through an appointment or you use the staffing note feature, notes can also be logged in like court dates and court outcomes. Right now, those all go to different places in the client profile. So you've got to kind of A, know where to look, and B, do some clicking around if you're trying to get a summary of someone's, past month within the treatment court. So we will be creating what we're going to call an activity feed that will condense notes from those different features into that sort of Facebook feed style feed that you can scroll through, which will probably make you spend less time in this area anyway. I think that because we're not going to be sending appointment notes here, we're just going to send all notes into that activity feed. That's really what we're going to be prioritizing before sort of improving this view. And that'll also include sort of the outcomes, the probably other things like drug test results, so that it's going to be kind of a comprehensive feed of the participant's activity within the treatment court that you'll be able to scroll through and filter to specific activities and things like that. So that's something that we're definitely prioritizing. It will probably live somewhere on this sort of main profile page, or it may end up being a menu over here. So once that's available, we'll definitely shoot a video out about that, but that's going to help to unify all of those records into an accessible place that, you know, especially someone like an attorney or a judge who doesn't spend a lot of time in TCMS would be able to locate and easily navigate. Okay, any questions before we move into behavioral responses? Okay, so behavioral responses is equivalent to what you currently know as incentives, sanctions, and interventions. So it's essentially the same feature, but we're calling interventions service adjustments. To launch this part of the client profile, you are going to want to be, you know, in a profile. On that left-hand side, you're going to click where it says behavioral responses. And once you're clicked into this screen, you'll see at the top, we have incentives, sanctions, and service adjustments. So we can toggle through those just by clicking on those tabs there. From what I've learned in the trainings that I've been in so far, it sounds like coordinators for the most part will be the ones logging incentives and sanctions because that happens during court and they're the ones resulting those court outcomes and documenting the happenings of court. Service adjustments, or again, what you currently know as interventions, is something that we're envisioning being logged in real time by either the treatment provider or the case manager. Yeah, Joe, jump in for sure.
Sure. I just wanted to jump in and let you all know that Danielle Hansen and I worked a lot on providing reconnect with some of the options that you'll see within the incentive sanctions and service adjustments. And you're going to notice that there's a little bit of a difference from the way it is in SCMS. So what we relied upon was All Rise recommendation for how to do incentive sanctions and service adjustments. And one thing that we noticed was a lot of the things that including us when we were coordinators and what people are doing now and calling sanctions are actually service adjustments. So as you are looking through these and playing around in the system before go live, you'll notice that. And I would point you to look at the All Rise documentation on incentive sanctions and service adjustments to give you kind of an idea of why we did things the way we did, including what Sophie has on her screen showing learning assignments versus supervision adjustment and treatment adjustment. So I just wanted to give a little bit of a background on why we have shifted this direction. And Reconnect also, I think, wants to set this up to align with best practices as well.
So depending on the category of response that you select, you'll see different adjustments options appear in the drop down below. And there's kind of a decrease and an increase option depending on the behavior that you're responding to. The amount is going to depend on what you select. Is there a community service adjustment, Joe, where the amount would be kind of the amount of hours, or is that amount typically going to be one?
That's an interesting one. I think we need to figure that piece out. I think it would probably typically be one with a note of what's actually being done. Yeah, that's an interesting field. We'll have to figure out how to guide on that one.
Okay. Yeah, I think for now you would leave that as one. I think when we log a sanction, sometimes the sanctions you select are like, jail time, whatever the formal way to describe that is. And then community service increase. In that case, the amount would be more than one, depending on the number of days or the number of hours that are being increased. So that's where that would make more sense. But I think for here, it's just typically going to default to one, which it does. And then you can put any notes and you'll see it logs you as the person who delivered the adjustment. That also, I think, makes more sense for a sanction. If the coordinator is logging that the judge ordered the sanction, they would put the person who ordered that as the judge instead of themselves. We just hit submit. And we see that log here in the service adjustment. So again, the whole team has access to this. So it's just kind of a warehouse for team members who maybe don't log this information, but want to see a record of what incentives and sanctions and adjustments the participant is receiving. Yeah. Anything else to add, Joe, before we move on? Okay.
I don't think so. No.
All right. So we're going to go back, talk a little bit about test results. This deck will be available next week. So that's why I designed it more as a training resource than as something to follow along in the training itself, but I do want to use it for talking about test results.
Since you're mentioning that too, Sophie, I just want to throw out, I meant to say this at the beginning. We will be sharing, like Sophie just said, the slide deck as well as other materials and links. But we're waiting until these 2 weeks of training are complete, and we'll just send an email to everybody who attended. So if in case you're wondering, don't worry, you will have access to a lot of this information.
So there's two ways that test results can be logged in Reconnect. The first is to have someone enter those results manually. The other is through our Redwood integration. So if your program is using Redwood and your test results are automatically populating into SEMS, that will continue to happen in TCMS. But not every program is using Redwood, so we're going to go through how to do the manual entry with this group as well. I can't demonstrate the Redwood integration, so I'm just going to kind of provide an overview and guide you to where those test results will live in Reconnect. And then for manual entry, we'll actually be able to practice that. Test results can trigger alerts in Reconnect, so specifically dilutes, positive results, and no-show attendance can all trigger an alert in Reconnect. So the next thing that we're actually going to talk about is how to result or document the outcome of those alerts by confirming or excusing them depending on the situation. And then we'll go through how to access historical test results in the system as well. So just before I move out of the slide deck, I'll just talk a little bit about the Redwood integration. So with this integration, results will automatically sync from Redwood into Reconnect. There's going to be an ID number tied between the two systems that will bring those results into the correct profile in Reconnect. Positive results will come in as positives, and they will need to be changed to approved positive if that's applicable for the participant. So as part of that workflow, we'll be surfacing participant MAT data into the sort of test result report so that whoever is responsible for, which is probably the coordinator in most cases, updating like positives versus approved positives, that information will be readily available. Okay, so everyone can follow along. I'm going to do it right from the dashboard. You can do it from the client profile as well, but those of you who are logged in and practicing, launch that quick action in the lower right again and click add bulk test result. Again, don't be thrown by the word bulk. I think for those of you who do log test results, you may have, multiple negatives that you need to put in which case you definitely want to use the add bulk test results. You're going to select all the clients who tested, who have a negative result that you need to input into the system. But you can also just log a result for an individual client from this feature as well. I'm going to go back to my test client. I am going to document their attendance. So if they didn't report, I would select that. But if they did report and provided a sample, we're going to put that attendance as reported. And then we're going to put the test results. So I want everyone to document a positive test for their client who is following along so that we can look at what that alert triggers, how the alert looks when you get a positive test result in Reconnect. And just hit submit. We will be adding at least one additional field to this. So just kind of an important point of clarification. This training environment is not fully configured to OJD specifications yet. We are rapidly designing and developing additional fields for both the client profile as well as features like test result logging. So one of the drop downs that we'll be adding here is the ability to document the level of the test. So if it's, someone tests positive for alcohol and you want to put the alcohol level, you'll be able to do that. But just to sort of get a feel for the workflow as a whole, go ahead and log a positive test result for your test client and hit submit. So there's two places that result goes. The first is right here on the dashboard in the drug testing report. You may have to refresh and to see the test result. I just had to do that. It will update on its own, but if it's not updating fast enough, you can always refresh just to kind of like hard launch it. So we see here is that positive that I reported for my client for cannabis. I actually want to take this moment to remind folks, especially those who didn't see the video, that you can customize the columns that you see in these tables. So your table probably looks different from mine. You may have additional columns or additional columns that are perhaps not useful to you, such as I think like this table defaults to showing an external ID column. That's probably not super valuable to you as you're just wanting to look at test results. So to turn columns off, you click on these three bars in the upper right, and you toggle the columns off and on that you don't want to see. So that, toggling that column off, and I think I turned a few other ones off, like maybe I don't care about the panel used, especially if I'm just viewing tests rather than logging them. So I can turn that off. I could turn notes off. So now I can see that attendance, which I think is really important for everyone, and the substances found in the case of the test results, obviously very important too. So I can see the test results, the attendance, and the substances found. So those table preferences are going to save to your browser, which is kind of unusual, but that's how it works. So if you were to log into Reconnect on your phone or a different computer, just know that those table preferences will not be there. They're tied to your browser's cache specifically. So if you clear your cache, those preferences will also clear out. But other than that, every time you visit Reconnect, those table preferences should save unless you, again, are on a different device or if you clear your browser's cache. So that's how you can customize the columns that you're seeing in those reports. Another thing to note, kind of circling back to talking about the table that we're in right now, this drug testing report defaults to the current day. And you can't toggle to past days from the dashboard, which I actually think we should probably update. I think that's sort of inconvenient, but it is the way it is today. So to get to past days, and this would be like allowing you to get a kind of comprehensive review of test results across your caseload, you're going to click where it says full report. And then you're able to toggle to days in the past. I don't know how much folks on this call would really use this, but I just want to call out that report is only showing the current day until you visit the full report and toggle to days past. But again, any positive results will trigger an alert. So you're going to be notified of positives through that alert system, and you don't need to be like reading this report every day, essentially, to get information about positives. Also, if we go to the client profile, on an individual client level, test results are going to live in the client profile in the substance testing field on the left. I will also take this opportunity to quickly call out that Reconnect offers drug test randomization and participant notification. That feature will be, some of your programs may already be utilizing that. We have several treatment courts in the state that are utilizing that feature. It is available to all programs when we go live. So those of you who are already using it will be able to continue using it, and others will have access to it if it's of interest. I'm going to show you really quick how that would impact what you see in this feature. So when the randomization service is turned on, we get some additional data in this table. It's going to tell us who's required to test today according to the randomizer, and it's also going to tell us whether they checked in for testing or not. So when you use test randomization through Reconnect, participants still have to check in every day as they do now. They're, calling, you guys are probably using either like the Redwood call-in line, or your program sets a voicemail every morning, perhaps, or your treatment provider does that. That participants have to check into daily. So that's still the case in Reconnect. We don't like call them or text them. They have to go and find out if they have to test. So it's that daily accountability. And they can either check in through our mobile app, and I'll show you what that looks like a little bit later in the training, or we offer a call-in line as well. So if your program wants to utilize this, but not everyone in your program has a smartphone, just know that we have a call-in option for this feature specifically. So this checked in column is going to tell you who has checked in this morning and who's required to test. This example is a little confusing because typically this would just say test required, yes or no, but this account is showing what tests are required. So it's going a step further and like randomizing the specific type of test. So that's why you see test names here. But again, this would typically just say, yes, tests are required. And then you have your results and attendance field here. So this came up in some of my trainings last week where programs are already using our randomizer and they want to be logging attendance prior to actually inputting the test results. So doing that right from the drug testing report and filtering this to test required. And then as people come in, you can just switch this attendance to reported or did not report at the end of the day. And that's how you can kind of easily log that. So for those of you who are following along, you should see a positive test alert for the results that you just entered. So we're kind of transitioning now to talking about alerts. Again, this is known as pending violations in SCMS. The things that you'll see trigger alerts in Reconnect will be test results, which includes positive UAs, dilutes, and if participants are marked as did not report under the attendance. Other things that can trigger alerts would be if you result an appointment as missed, that will trigger an alert. Those are probably like the key examples that you'll see early on. There are lots of other alerts in our system related to case management features and related to our engagement app, but those ones I just mentioned are probably what you'll see most frequently. So alerts can be accessed in a couple of places. First of all, you will get an email if your participant receives an alert. You can opt out of those emails, and I'll talk about that a little bit later, but I recommend having them on in the beginning so that you are sort of remembering to check the system and being notified of key activity related to your caseload. Alerts will also go to the dashboard. There's an alerts widget here. And then this exclamation point icon is also your alerts feed. So this is where I want us to sort of talk about the feature. You see I have responded to alerts. That's that kind of 531 icon. So alerts come into Reconnect with the status of open, and they're designed to be resulted by a staff member. The way that you do this is you click on the alert and you confirm or excuse it. And that kind of marks your activity with that alert and that you're documenting whether it was true non-compliance or there was an excuse or reason for that occurring. So let's say that a participant gets marked as did not report for testing because they no called, no showed. And then you find out later that day that they had a very valid excuse for not showing up for testing. In that case, you would come into the alert and excuse it. Possibly you would put a note that says participant was in a car crash and missed testing. You save that note, you excuse the alert. Confirming the alert means you're documenting it as true noncompliance. Those can always be changed. So if you document it as noncompliance and then you find out 2 days later that there, was a part of the story that you were missing, you can always go in and change your result of those alerts. But that is the basic expectation for controlling those alerts. I want to point out that this alerts feed that we're clicked into, again, it's just the exclamation point icon. This defaults to showing you open alerts only. If you want to just kind of come into this report and like, let's get a feel for what alerts have been coming in for my caseload and who's been responding to them and what they've been responding, you can clear those filters and it will just show you all the alerts in the account. So just know that both alerts reports, both on the dashboard and in the client profile, default to showing open alerts only, but you can clear that and view all alerts from either of those reports. So speaking of the client profile, let's just make sure everyone knows where to see alerts there. So to view alerts to a specific client, if you go to their profile, click on their name, and then in the upper left of that menu on the left-hand side, there is an alerts table there. Again, this defaults to only showing open alerts. I think that should probably change, especially in the client profile. So if you want to see a comprehensive list, just clear out those open alerts filters, and then you can see all alerts pertaining to that client and whether they've been confirmed or excused. Okay. Next, we're going to talk about documenting sobriety in Reconnect. And before we do that, I want to show you what this looks like in the participant mobile app. So I'm going to go over this slide when we actually talk about the mobile app. What I want you to focus on right now is this dark blue tile here that shows sobriety time, and it also shows a personal streak is what we call these for the participant. So this feature is what we're going to use to document official program sobriety time. It can also be used to track other types of goals or streaks for the participant. If you're using our mobile app, they will see their program documented sobriety time on the homepage of the app, like you see here. You can also put in their personal sobriety time. So we have some programs that have that program official sober date as well as a personal sober date. You can put both in, the participant will see both. And you can also put in things like nicotine streaks or even things outside of sobriety you can use this for. So if you want your participants to know how many days they've been in phase 2, you could set that as a streak for them. So it's very customizable, but it is the official program's documented sobriety. So that's at a minimum what we need to be using this for. So this feature lives in the client profile. And we're now going to be in that kind of blue demographic section in the Success Streaks tab. So you may not see success streaks at the top of this menu. This is another part of your account that is customizable. You can drag these sections to be in whatever order you want. So there's a lot of sections. I mean, I'm on my laptop screen right now and I can't see all the sections at once. So the section that you're using the most is at the bottom of the list. That's kind of inconvenient. So know that you can drag that by clicking the 6 bars to the right of the section. You can drag it up and bring it to the top so that it's always just kind of easily accessible to you. That will save, again, to your browser's cache. So it's not going to save if you're on a different device or if you clear your cache, but otherwise it will save every time you log into Reconnect, and any profile you visit, that is the section that you'll see at the top. So success streaks, I'm going to delete all the streaks that I have. And actually, real quick, we've had a little bug with all the fake clients that we imported into the system. So for those of you who are following along, before we get into this, I actually want you to go to the contact section of the client profile. And if you see under add or edit phone numbers, if you see this empty primary number box, just click that little orange minus sign and delete that phone number attempt and hit save. For some reason that got triggered when we added all of these fake clients into the account, and it will prevent you from being able to save a success streak until you delete it. Okay, so navigating back up to the success streaks tab, we're going to click on the right-hand side. We're going to click add or edit streak. And for this first streak, it's going to be our official program documented sobriety. For that option, you need under the title dropdown, you need to select the sober option. This is important because that is the option that pulls onto our staffing report. Substance free does not pull onto the staffing report. So we need to use that official title of sober in order for it to get on the report for court. I know that that term is potentially controversial or not everyone uses it. It is something that is kind of already on the radar that we maybe want to have more flexibility for. But right now, for consistency across the state and for the way that Reconnect is designed, that is the term for the official program's documented sobriety for now. Next, we're going to pick the date of the participant's last UA. And last, we are going to click this little lock icon on the streak. So what that lock icon means is that if you are using our participant mobile app, the participant is not able to edit the streak within the app. So you saw in that example that I provided that I had a streak in there for nicotine free. I don't, as a case manager, want to have to update that every time the participant smokes a cigarette. So for that streak, that's something personal that I gave them to modify themselves. We're going to leave that one unlocked so that anytime they relapse on nicotine, they can document that and update the streak themselves. We do not want them to have that capability for their program documented sobriety time. So locking the streak blocks that access within the app for them to modify the date. So we're going to hit save on that streak. And then just for practice sake and to show you how this tool works, we're going to click that plus sign again and we're going to add a second streak for our client. And I want you to know that you can free type into this field. So you see that nicotine free is not an option here. So I can go ahead and actually type that in. And to create that streak, I need to click this suggested like add nicotine free. You're basically creating it as a custom dropdown. So I need to click that in order for that to save. I can leave that streak unlocked and I can leave the start date incomplete and allow the participant to enter that themselves and hit save. Any questions about that?
Not a question, but I just want to highlight how great of a tool I think this is for your programs going forward to be able to, have things that like sobriety or sober date that you can manage that are court, locked down by the court based on the actual documented sobriety date, and then also having the things that the participant can have a little bit of autonomy in meeting some of their own personal goals. I really am excited that having this tool will make them feel a little bit more of a part of their program.
Awesome. Okay, so staying right here, we just want to draw your attention to some of these key demographic sections that you will need to modify. Before we go further, though, I just want to remind everyone that these profile sections have not been configured to OJD's requests within this training environment yet, at least entirely. So if you, I don't know, are in the military section and you see that there's drop downs or data missing related to what you currently log in SCMS, just know that there's like over 100 additional profile fields that are being created over the course of the next couple weeks. That being said, the areas that we want to draw your attention to include the screening section. So this is where you're going to document your assessment scores for your various assessments that your program is administering. This is fully not configured to OJD right now, so we know that no one in the state uses the ORAS, for example. So that will be hidden, and your LSCMI fields will live here instead, where you'll be able to document those scores, those screening scores in drop downs within these fields. One thing I want to call out that's come up in all of my sessions in person so far is, where do we actually upload the completed assessment? That happens in the documents tab on the left. So they're kind of going to be in, the scores we need documented in drop down so that we can report on that data. But for those of you who upload those completed assessments, those will go into the documents tab. And that's a little different than SCMS. I'd love to have you be able to upload those completed assessments right from this profile section, but our profile area doesn't support document upload yet. So that's got to go into the document section for now. Other areas that we envision this group updating would be the employment and education. So documenting changes to employment status as that becomes available, or that information becomes available. Address updates are going to happen in the contact section of the client profile. So anytime they get a new address or they get a new phone number, that will be updated there. Yeah, I think those are the key pieces. The other thing that I want to call out that's going to be different from SCMS. So first of all, everyone who's on this call, other than the folks that have that other role, will probably have more edit capabilities within the client profile than they're used to. And the way that we are achieving that is by creating an audit trail of all changes that are being made within the profile. That audit trail lives in the records section for now, so it doesn't live directly next to the field itself. That's something that I think we'll probably see change over time, but for now, any changes that are made within the client profile live in this records tab underneath client audit. So once you click records, you'll see a drop down appear and you can click on client audit. This is going to document all changes that are being made. And you'll note that it defaults to showing you changes within the client profile, but you can also view changes in other features as well. So service adjustments, sanctions, that sort of thing. So that's where those changes will live, so that we have that historical data as well. Anything else about client profile fields before we talk about uploading documents?
Sophie, we did have one question about streaks and the staffing report. I know that the sobriety date does show up, but do other streaks also show up on the
They
staffing
do
report?
not currently. Nope.
Okay.
Yeah, good question. Okay. So staying right within the client profile, we're going to navigate over to the Documents tab and click Upload Document. So this is how you upload documents from your computer into the client profile. You note that there is this Visible to Client option that is off by default. And anything that you upload where that is not selected, the participant will not be able to see. That could be valuable if you're uploading like a signed consent or an acknowledgement form, that sort of thing, where you might want the participant to have access in the app. You can toggle that on, but otherwise it's off by default. Viewing documents is a little funky. So here is just a document that I uploaded for my test client. I can't click on this. Right now you click this edit button and then you click view file. I don't find that to be super intuitive, so I'm probably going to provide that feedback, but in the meantime, that's how you get to a document that's been uploaded. All right. Any questions? We're going to talk next about how to run the staffing report, and then we're going to transition to talking about our mobile app and sending messages through the system. So the staffing report will be, the final piece of that kind of case management suite that we're going to cover. So before we move into that, does anyone have any questions about the client profile or the dashboard or anything else that we've covered today that I can clarify? Okay. So I'm going to go over how to run the staffing report. I know that not all of you may run this regularly. It seems to depend, court to court, whether staff in the program are running the report or the coordinator is running it for everyone. So just know that we're all going to go through that together, and it'll obviously depend on how your program operates as to whether you're actually running this regularly or not. So I am going to provide quite a bit of detail about how to do this for those of you who do it on a weekly basis for court. Others, it may just be, sent to you within the system, pulled by someone else. So to run the report for staffing, you go to the reports tab and you click staffing sheet. You'll see here that I have various program or profile sections that I can pull onto the report. For the purpose of our training, just go ahead and toggle on all sections for those of you who are following along. One of the configured items for OJD is that certain sections will be toggled on by default and they won't be able to be turned off. Other sections will be optional. So depending on what your judge wants to see or what you guys need to be reviewing in staffing, you'll be able to turn certain things off and on. Like if you don't care about seeing their family information on the sheet, I think you'll be able to turn that off. So there'll be some options here for customization and then other things that will be required. Next, we want to look at this date range. So this is the time frame of activity that you're pulling into the report. So things that are more activity based or like, I don't know, I so struggle with these, but like, yeah, do I want to see incentives and sanctions from the past 2 weeks, or do I want to see incentives and sanctions from the past 3 months? Do I want to see appointment? How far back do I want the appointments shown on the report to go? How far back do I want the staffing notes to pull? So that time frame is going to default to the past 2 weeks, but depending on the group that you're seeing in court, you can update it to go further into the past, or you can look at just the past week if that's more relevant. Down below that is how we decide which clients we're pulling the report for. There's essentially 3 options here. You can select people's names manually from this client's dropdown. If you click on this wrench icon next to the client's dropdown, you can select clients based on caseload or client group. This is going to be a really important feature for pretty much every program in some capacity, is to use this client groups categorization tool to categorize your participants according to anything from phase to, it's fully customizable. So I had a program last week where not everyone in phase 1 reports on the same day. They have people in phase 1 who report on Monday, and then they have people in phase 1 who report to court on Wednesday. So for them, I suggested you should create a client group for phase 1 Monday court, and you should create a client group for phase 1 Wednesday court, so that when you're pulling this report, as well as scheduling court appearances, you can select everyone who, is in that category all at once. So that's something we can help advise you on according to your program's like individual preferences. But you see when I selected phase 1 in this account, I automatically got like 15 clients who are in phase 1. So that's another way you can select people in bulk. The other way is that you can select by docket. In that case, where it says standard client selection, you're going to toggle on court date selection, and then you're able to select the court date, and it's going to show you, it's going to select everyone who has court scheduled for that day. Your coordinator is going to be the one scheduling court, so that should already have happened. So if you have folks scheduled for court today, you can just toggle on by court date selection, and it's going to give you everyone who's scheduled for the docket that day. I am going to just select my test client, and I encourage those of you who are following along to do the same. And then to run the report, at the top of the screen, you click this fetch button. That's going to run the report, which depending on how many people you have selected, this could take up to 60 seconds. So just know that that can load a little slowly if you've got like 15, 20 people selected. Then you're going to click view once it's loaded. And you're going to be brought to our staffing sheet for that group of participants that you selected. So the layout of this is quite a bit different than what you're used to in SCMS. What I want to call out for this group specifically is that appointments appear in the lower right. And any notes that you document in the appointments tool will appear here. And then any notes that are logged with that staffing tag are going to appear in this section. This client's got a little bit more activity than is probably likely for someone in between court appearances. So typically this would be limited to 1 page, but because I've been using this test client so much, we've got a lot of data on this report, which is what's causing it to, go down to the 2nd page. But it is designed, and it's just going to depend on how long your appointment notes are and how long your staffing notes are. We obviously can't fit like infinity data on 1 page, so it is designed to restrict it to 1 page if at all possible. But if we've got a lot of stuff going on like we do here, it's going to go down into the 2nd page. But yeah, that's where your appointment outcomes and notes live. And then your staffing notes live over here on the left. And then any behavioral responses, test results, sobriety date, just kind of get familiar with where that data lives on the sheet. One thing that's come up a lot in the in-person sessions is this team working with the client. That's been of interest to several groups that we've chatted with. That gets documented from the client profile. It is the client contact section where you can add or edit team members on the case, as well as their contact info. So if that's filled out, then that data will appear on the sheet. Another thing that's come up in our in-person sessions is that when case information is logged, you can put someone's probation end date into their case information, and that will pull onto the sheet as well. So if that's something that's important for your judge and other team members to be able to see, you can pull that onto the report in Reconnect. Questions about running the staffing report or any of the data shown here? Okay.
I just want to highlight that I've had a lot of feedback over the years on SCMS that people were not necessarily happy with the staffing report, with the layout. So we're excited about this new layout. And also, I've had a lot of feedback where people don't want everything on the report. So this will allow you a little bit more freedom to decide what you want to see specifically for your staffing report. So we're pretty excited to be able to share that with you all.
Awesome. Okay, so now we're going to take a little time to learn about our mobile app for those of you who have not used it before. So the first and foremost, most important tool that we are providing to the state of Oregon is the TCMS Reconnect system, which is your data management tool. That can be used and should be used independently of our participant mobile app. But this is kind of an added bonus, and it's something that integrates into the TCMS system to provide your participants with access to program information and resources, the ability to view their, which I realized I didn't talk about goals. We'll talk about that at the end. their phase goals and treatment plans within the app, access program documents, view their sobriety time, things like that. So it integrates with, again, various features of the TCMS system. It's designed to be downloaded onto their personal phone. They do not need like a Reconnect phone to be able to access this. And I don't think if there's anything else I want to add. It doesn't use a phone number. So just like any app that we have an account for, we have a username and a PIN or a login that we use to access that app. So it doesn't depend on their phone number. So if you have folks who change phones frequently, this is a way to have kind of a consistent form of contact and communication with them that is not phone number dependent. So some of the features of the app that integrate directly with the TCMS system are the court date reminders. So when participants have court scheduled in Reconnect, they will see their next court date at the top of the screen. They will be able to view their program sobriety time as well as any other streaks that you've set for them. They'll be able to view their phase goals. And if your treatment provider is using our treatment plans in Reconnect, they'd be able to see their treatment plan and as well as any other goals that have been assigned to them by you or anyone else on the team. They can view appointment reminders. So if you schedule those appointments in advance, they will see that under their current task and they'll get a push notification reminder from the app about that appointment. I think those are the key pieces that are sort of like integrated into the TCMS features. Outside of that, other features that we provide through the mobile app that will be available to your programs are the ability to upload documents and resources to the home screen of the app. So this can include like things like your handbook, online websites that you guide people to, like maybe there's a site in your community that helps guide people to community service opportunities within your county. Or if you have a program website that you want to guide people to, anything that's a PDF or a website, you can upload into the home screen of the app for people to be able to access on demand. We provide communication tools. So this includes direct messaging with participants, group messaging between multiple staff members and a participant. So if you need to discuss an incident or, strategize around services that you're providing to someone if they're in crisis, whatever that may be, you have the ability to communicate with them with other members of the team in the chat. We also offer sort of announcement style messaging. So you can blast out program updates, logistics changes, scheduling changes to multiple people at once, and it goes to each participant as a private chat. So even though you sent it to 10 people, it's going to each of them as a direct message and they can respond, and it's a private conversation between you and the person who responded. So great options for announcements and things like that. And then we also offer engagement-based goals. So rather than just like viewing my phase goals, which is just kind of like a view-only experience, especially early on in that feature, we have goals that the participant can actually interact with. So that could include requiring them to check in at 2 support groups a week. It could require them to upload a picture of their sign-in sheet. We also offer support group attendance forms. So reflecting what was the meeting I went to, the topic of the meeting, what did I get out of the meeting? So you can assign those types of things as goals. They can automatically repeat weekly or monthly, and they're designed for the participant to actually be engaging with the goal by submitting those location check-ins, submitting pictures of their sign-in sheets, or completing those support group attendance forms. We also offer a learning management system. So we've got about 25 courses, mainly centered around life skills and treatment, that can be assigned to the participants in the app to complete. So lots of different ways to engage with folks and, get them participating in their program requirements, kind of in between court appearances and visits, and just, having more on-demand access to program information and resources. So here are 4 screenshots from the participant mobile app, just to kind of give you a view of some of the things that they might see if you're using this. So on the left, I have checked in for testing through the app, and I'm being told I don't have to test today. So that's part of our drug test randomization offering. That is an optional tool. It will be off by default, except for the programs that are already using that in Reconnect. So that's what it looks like if you check in for testing through our mobile app. That's what the participants see. Again, we do offer a call-in line option for that feature as well for people who don't have the ability to access the mobile app. To the right of that is just another screenshot of what the homepage of the app looks like. So down below, I have one of those learning management system courses assigned, and then I also have a packet of program information and resources that I can open, which is going to bring me to a page of like, here's this website, here's this PDF that's been shared with you by someone in the program. To the right of that, we have one of those interactive goals. So this goal is set to automatically repeat every week on Monday. The participant is required to check in at 2 support groups by the following Sunday. They are required to complete 2 of those support group reflection forms. And I have just kind of an example of how you could use this for more of like personal engagement. So you could set a goal that was upload a photo and a brief description of a healthy or pro-social activity that you did this week. And again, the participant is actually going to click on that bubble, and the app is going to prompt them to attach a photo and write a brief description and submit that to their PO or case manager, or whoever is responsible for viewing those goals. It's a very open-ended feature, so you can like free type these things in here. You're not listed, required to select from drop downs. You can just type in whatever goals you want, and then you assign tasks to the goals below that. So that's a great feature. We do have several programs utilizing it within this type of context already. And it's a way to improve your collection of the support group attendance and provide a more accountability driven option. By requiring participants to check in with their location when they get there, you can at least know that they showed up to the front door. The support group attendance form is meant to, ask them questions about who led the meeting, what was the topic. So not to say that I couldn't show up to the door, check in, and then learn about who led the meeting from one of my friends who actually went, but at least you're getting them to the door, and you're making it a lot harder for them to forge that they went, like versus a sign-in sheet. We know that, every program struggles with those being counterfeit is the word that comes to mind. I don't know if that's the right word. But so yeah, just kind of an alternative there, to build some additional accountability into those recurring program requirements. And then on the right, we have what our communication suite looks like on their end. Joe, anything you want to add here before we start talking about messaging, or any questions from the group about the participant mobile app?
No, I just want to highlight again the support group check-in is huge. I know that there are a few programs who've been using it already with Reconnect through the CJC funded version of Reconnect, and I know there's been a lot of success. The one thing I want to highlight that we share with the judge attorneys session as well, the goal here is not to gotcha. Like if they do a GPS pin drop for this check-in, it's really about accountability for treatment. And so the reason that we've allowed some of these GPS pin drops for things like, which we'll talk about messaging here in just a second, but also for the check-ins, is really to support the treatment and honesty for treatment. So I just really don't think I can say that enough. Don't utilize that tool in a way to put people in jail. That's not the point of it. The point of it is really to address honesty and treatment. So I'm going to keep screaming that from the mountaintops.
Any other questions? Okay. So one of the engagement tools that we offer is the ability to communicate with the participants in the app, as well as just to communicate with other staff. So going back to Reconnect, we're going to do a quick overview of our communication suite. So to get here, you're going to click on that chat icon on the left, and you're going to be brought to our messenger. So the way this messenger works is that you need to establish what we call chat rooms to begin sending messages. You may be added to chat rooms by other staff members, but you can create your own chat rooms anytime by clicking on this plus sign right at the top of that sort of rooms list. And you'll see when you go to start a new room that you can select a participant and or multiple staff members. So there's a couple of different use cases that we think will be helpful for your team. Right now, you can only ever add one participant to a chat, so you can't group chat with multiple participants. If you ever see a value add for that, let OJD know and we can explore that further. But right now, group chats in Reconnect would only ever consist of one client with multiple staff. You don't have to add a participant. So if you just want to be direct messaging with another staff member or several other staff members, you would just select multiple users and you would leave the client field blank. You can name chat rooms, but I want to caution when you choose to use this. So if I want to chat with a client and I just want it to be me and that client, I am not going to name that chat room. What I find like folks are drawn to is naming the room the participant's name, but that doesn't work well in the participant mobile app. Because if I name this room Aaron Verberg, when Aaron Verberg goes into this chat, he's going to see his own name at the top of the screen, which is confusing. Like, I want to see the person's name who I'm chatting with. I don't want to see my own name. So just don't use that room name unless there's some sort of topic for the room. That's when I would use it. So if it is a group chat with multiple staff members and a client, and you're talking about a specific goal or an incident, or you need, it could be like Sophie Veyu's treatment team, something like that, where it's more obvious, but otherwise I would not use the room name. Yeah, Joe.
One of the things that we want to suggest is that a lot of programs are utilizing emails to do staffing when maybe something comes up between your regular court dates. And so what we want to encourage everybody to do is to maybe start using this tool. And this would be a good opportunity to use a room name if it's just staff. So say it's the treatment court team you've added as users, then go up and label that room staffing and then the last name or the name of the participant. And then you would make sure you would not want to include the client, but that's going to allow you to go back and forth and have discussions that are protected behind the secure login within Reconnect versus email, which is really kind of more open and susceptible to being, like hijacked. And we've had instances across the state where people's emails have been hacked. So doing it within this system is a much more secure, stable way to do that communication. And so that's an excellent opportunity when you would use room name. But I also want to highlight, don't do one general staffing room and just talk about everybody in there every time. If there ever were any kind of requests for information from the participant or a public records request that we needed to investigate, it's going to make life very complicated for you if you've been talking about 80 different people in one staffing chat. So one staffing room per participant. And then there's always ways to archive those once you're done with them or if the participant leaves the program. But that's one of the main areas that we're going to suggest you utilize this functionality for.
Awesome. So another thing I want to point out, a participant can't chat with you until you create that room with them. So if you don't want to talk to somebody in Reconnect, you just wouldn't create a chat room with that person and they won't be able to reach out to you here. Once you create a chat room with a participant and you send a message in that room, the participant will always be able to message you in Reconnect until you archive that chat. So that's kind of how it works in terms of getting them to engage with you. You've got to create the room with them. Again, don't name it, and send them that first message, and then they'll be able to go into that room and reach out to you at any point until it gets archived. Once you are communicating with someone, there's a couple things to note within a message itself. You know, we can like react to messages here using emojis. Participants have access to that as well. You can upload documents. You can schedule messages to deliver in the future. And then this light bulb icon is going to give you read receipt information. So you'll be able to see, did the participant read your message? And if so, what time? Everything that is sent through this tool is immutable, meaning it can't be altered or deleted, to the point where if you accidentally send, like I have this come up every couple months, someone sends information to the wrong participant, you have to reach out to Reconnect to get that message to delete. We do have this sort of flag sensitive content. I actually think that you could use that to hide the message from the participant. I'm pretty sure that that does hide the message from both parties, but the staff member would be able to see it. So just know if you ever do send a message by mistake, reach out to Reconnect to have it deleted, but you can flag it, and I think it will hide it from the participant if you do that. But I actually don't, I need to confirm that. That idea just came to me in a different training last week.
Can I jump in real quick too?
Yeah.
One other thing I wanted to say is, um, like exactly what Sophie's saying, that that really just think of it like nothing can be deleted, so that you don't put things in here that you don't want in here. So always keep in mind to everybody can see what I'm putting in here. So you aren't going to want to talk in a way that you wouldn't want someone to see. That also means, like, for participants, one of the things we tell the defense attorneys is talk to your participant. Don't go trash talking a team member in the chat, because they're going to be able to see this. The whole team can see all of the chat messages as long as they have access to that participant. So I just think reminding yourselves and your team that this isn't a private chat, even if it might seem like it. It's really being documented as part of the case record.
Okay. Other thing I want to point out here on the left where it says bulk message send, this is our bulk message feature. So when you click here and you click direct messages, we see that we have the ability to select multiple clients. Again, we have this little wrench icon. So grouping participants according to phase, according to what day they go to court. If you have people who always report on Monday, you could create a client group for that. It's a fully customizable categorization tool that allows you to select multiple people efficiently. So definitely talk to us and talk to your coordinator about creating client groups that will help you use features like this more conveniently. But when I select multiple clients and I type a message here, when I send the message, it's going to go to each of these people privately as a direct message. So if you have court that gets canceled last minute, or there's a natural disaster going on and you want to inform people of resources, you can use this tool to get announcements out quickly without creating like group chat chaos where they're going to see each other's names and responses and everyone's phone's going to be blowing up like crazy. And then obviously if participants respond and share something personal, that's going to go to just you. It's not going to go to the other participant recipients of that bulk message. So obviously, I have this. This is utilized frequently for scheduling changes and situations like what I just shared. I also have staff who use this to share like positive quotes with their caseloads every Monday. So like, there's other ways that you could think about utilizing it to build engagement as well. I think that's everything. And again, just highlighting that you can schedule these to deliver in the future. So if you want everyone to get a stock like happy holidays message on Christmas, you could create that as a bulk message, schedule it to send on Christmas, and then you just put like a disclaimer like, I'm not working today, so if you respond, I won't see your message. But just different examples of how you can take advantage of those communication tools. Any questions about the communication features? That's just kind of a high level overview. Okay, and the last thing that wanted to cover, I'm actually I'll just go to the slide deck for this. So I meant to chat about this sooner, earlier in the training, but I realized I forgot it. So I just wanted to throw it in since we have a couple more minutes. Participants will be able to view at a minimum their phase goals in Reconnect, and then the rest of the team will have access to this as well. We do have a goals feature today. That's the one I've kind of talked about, that they can auto repeat and they're designed to be engaged with by the participant, where they can check in at meetings or submit forms or pictures. This type of goal will be more view only for the participants, and it will be interactive for staff, but this is where we're going to track their progress toward required program requirements specifically related to phase, and if treatment chooses to use this, treatment plans as well. So some of the differences between the goals that we offer now and this updated version of goals is that right now our current goals feature is essentially like a list of steps that the participant needs to complete. This feature will offer more of a like parent and child step. So if we talk about a goal of obtaining employment, that's a pretty big goal that has a lot that goes into it. And there's a lot of coaching that we can be providing to the participant about how we're going to, get to that ultimate goal of obtaining employment. So the parent step would be obtaining employment, and maybe that's like a phase 3 goal. And then you'd be able to add child steps below that, or what are those kind of smaller baby steps that the participant is taking to ultimately obtain employment. So that'll be the structure of this updated goals feature, is that the parent steps will be collapsible, like you can uncollapse the parent step and you'll see the child steps below. The idea for phase goals specifically is that the program will have a general template for each phase that they'll be able to use over and over again. So they're not going to have to like type whatever the 50 steps are in phase 2 every time. They'll have a template for phase 2 that they'll apply to each participant when they phase up. But then you'll be able to edit it on the individual client level. So if part of phase 2 has something to do with like people who have children, and your participant who's in phase 2 does not have children, you'll be able to delete that step for that participant, as well as add additional steps if they have, unique goals that they're working toward. Another difference is that these goals will have more granular statuses that staff will update. Our current goals feature is the item complete or not? These will have things like making progress, making unsatisfactory progress, in progress, complete, incomplete, things like that. So there'll be more, granular statuses for each of the steps. And then it will also contain a notes feed for each step. So when you click on a step within a goal, staff will be able to see any notes that have been documented for that particular goal by other members of the team. Those notes will not be visible to the participant in the mobile app. But the sort of overall goals and steps will be visible to them when this feature is available. And if folks want to follow along just to get a feel for goals as they live and exist today in Reconnect, you can go to your test client profile, go to that quick action in the lower right, click Assign Goal, and select the template phase 1 goals, and click Assign. Then on the left, go to the Goals tab, and you'll see that phase 1 goal has been assigned to your client, and you can open it. And you can see, again, this is where it will look quite a bit different. Each of these parent goals will have action items below, so those sub or baby steps. There'll be a status versus a bubble, so you'll be able to mark each of those baby steps as, making satisfactory progress or incomplete, etc. And then when you click on the steps, there'll be a notes feed that pops up to the right. So none of that functionality is available in the current goals feature. But again, if you just want to kind of play with this, you can click on a bubble and mark it as approve. And you'll see that percentage complete bar go up. So that functionality will still be there. And I do want to highlight that goals will be optionally visible to participants. So if you have someone who's just entering phase 1 and you don't want them to see like the mountain of tasks that they need to complete before they phase up, you'll be able to, it'll be optional as to whether you share these in the app or not. So just know that that's how it will be designed. Questions? Okay, give me 1 second. Or actually, Joe, you shared it in the meeting chat already. But yeah, folks and Joe, anything you want to highlight before we kind of wrap up?
No, I think one of the things I just want to put out there is that Reconnect has been doing an awesome job of trying to help get us where we need to be on January 6th. And I also wanted to share that typically when you're rolling out a statewide or large organization case management tool, you'd want about 18 months to do that. And we are doing this in a 6-month time period so far. So there are a lot of things that Reconnect is working on for us, and the main goal is to get to January 6th in a way that we can function and do things, as similarly as we used to, or at least have the same capabilities. And then there are a lot of things that I know after the new year will be probably enhanced or improved. And I know that in my experience working with Reconnect previously, that they are continuing to evolve with their product. So I'm, from my perspective, very excited of having Reconnect as our case management provider, and I'm excited about the opportunities it presents for our programs across the state. So I just wanted to put that. But yeah, the QR codes there are 2 QR codes in the chat. The first one is if you have any general questions after today's session that you just want to throw in there, we will compile all of these at the end of the 2-week training period and put out some FAQs. If there's legal questions, we can talk to our legal department, see if we can get some guidance on that. And then the second QR code is just an overall survey about this training. So we would appreciate any feedback from any of you, and it helps us improve. And I want to thank you all for showing up today, and thank you, Sophie, for the informative training.
Yeah. Thanks, everyone. Bye-bye.
Bye.
Thanks, Sophie.